Thank you for joining us. My name is Shawn Scott. I'm your American Healthcare Association's Associated Business Member President. I'm joined today by AHCA's NCAL President and CEO, Mark Parkinson. Governor Parkinson, it has been a busy time here in Washington, D.C. We realized that the super committee in Congress couldn't agree on how to balance the deficit. We understand that sequestration has triggered an automatic 2% cut to Medicare providers. Right. But can you tell us how AHCA feels these cuts are going to affect the long-term care and post-acute care segment?
Sure. Well, you're absolutely right, Shawn. The super committee did not succeed, and as a result, the fallback sequestration bill has become law, which means that starting in January of 2013, all Medicare providers, including nursing homes, will face a 2% cut. And while that's not good, because as everyone knows, we work on very thin margins, that result is actually better than what we might have faced if the super committee had succeeded. They were looking at cuts in the super committee that were 3 and 4 times that large. So a 2% cut isn't good. It could have been worse, and I know that our members will work very hard to work their way through that cut, which will be challenging, but I think they'll do it.
Great. Obviously, there's a lot more going on here in Washington, D.C. than what we see in our evening news when we're back home. With all that going on, how do you think that's going to affect the membership here at AHCA, and what does that mean to the associate business member and how they should be prepared?
Well, you're right. Even with the 2% sequestration cut, we still face some other challenges. Congress is trying to figure out how to get out of town at the end of the year, which always happens, and there's a couple bills they have to pass, including therapy caps, which we need passed, and these bills cost money, and they're looking at cutting nursing homes once again. So there's 2 messages that I would have to our associated business members, in addition to just thanking them for all their support. One would be if they would go to our website, they could learn how to get involved in our grassroots activities, to email members of Congress and tell them not to cut nursing homes anymore. And if they could do that today, it would be great. But secondly, I think that associate business members should look at the challenges that we face as opportunities for them. You know, in virtually every other sector in the United States, we've become more efficient because of technology, and that has really brought cost down. Healthcare is the one area that has lagged. We haven't become more efficient with the advent of technology. I would say to our associated business members, any product or technology that they can come up with that makes our nursing homes more efficient, that improves quality and decreases cost, will be in huge demand and will also be greatly beneficial to our members. So help us politically, and then figure out products that help us succeed. Those would be my 2 main messages.
Well, that's great advice, and thank you very much for joining us today. I want to take this final message to send our wishes on behalf of Governor Mark Parkinson, Sharon Purvis, and everyone here at American Healthcare Association, wishing you all happy holidays and a happy and healthy New Year. Thank you for joining us once again. My name is Shawn Scott, your ABM President. First of all, I want to thank you for your generous support over 2011. And today I also want to talk to you about the opportunities that are available for you in 2012. I want to first talk about Provider Magazine. Our January issue, we're going to be talking about how to have good quality in a bad economy. In the February issue, we're going to be talking about quality and rehospitalization. And finally, in the March issue, we're going to be talking about the health information technology. All great opportunities for you to advertise in. We also have a great lineup of conferences that we still have sponsorship availabilities for. Starting in February, we're going to be talking about our Quality Symposium. It's going to be a great time for you to learn about AHCA's agenda for quality for 2012. And then in March, we have our first annual spring conference for NCAL. This will be a great opportunity to meet with assisted living communities and their executives. And finally, in the same month, we also will be having our independent owners meeting. If you're interested in a sponsorship opportunity for some of these great events, please make sure you contact us here at American Healthcare Association. Again, we look forward to seeing you in 2012.